In fact, they are often so important for various other things like income generation and ceremonies and so on, that they're not consumed very much by the people who produce them. And this is a great pity, because if they could produce more, their children would be better nourished by having a high quality protein in their diet. And currently, stunting in Africa of children under 5 is around a third of the population, which is not good news at all. And pigs could do an awful lot to help.
Welcome to the Swine at Canada podcast show, brought to you by Wisenetics. We are dedicated to bringing you the latest insights and discussions in the Canadian pork industry. So my name is Miranda Smith, and I'll be the host for today's episode. And with me today, I have Dr. Marie-Louise Penrith, who is an extraordinary professor at the University of Pretoria in South Africa. And she's been with us on the show before. So welcome back, Marie-Louise.
Thank you very much, Miranda. It's nice to be back.
Yeah, so you're also the president of the Global African Swine Fever Research Alliance. So last time when you were on the show, you were talking about ASF. Now, this time we're going to talk about something very different. And I'm really curious about this topic, which is understanding the global importance of pigs and why we need transdisciplinary research to resolve some of the challenges. So I think most of the people that are listening to our podcast show, they'll be familiar with either the North American or the European pork industry, the larger systems, big inputs. Obviously, that's not the same everywhere in the world. So can you first give us a bit of an introduction to why pigs are important in low-income countries and what those systems in those countries may look like?
Yes, thank you very much. I do hope it will be of some interest. The large pig industries are not something that I've been very directly involved in, because in Africa, our commercial production is very small. But I'd like to say that, first of all, pigs, of course, are very important in a very wide range of settings. And nobody can underrate the contribution of the highly developed commercial production in feeding populations in the world, the populations we've spoken of in Canada and in America and in Europe. But at the same time, a commercial production is present in a great many, obviously in Asia as well, and in a great many African countries and South American countries. But in Africa in particular, it's on a very small scale. So I am in Africa. I've worked in Africa all my life. So my experience of the world of pigs has been in African swine fever management in resource-limited settings, mainly in low-income countries. And so tonight you'll hear a little bit of the other side of the story, but that pigs are also extremely important in those settings, including in the area of food security. In these settings, pigs are mostly kept by poor people for whom they are a survival strategy, providing income to pay for necessities like school fees and medical expenses. In Africa and in the Asia-Pacific region, they often have very interesting cultural importance. They improve social standing in communities. And pigs may, for example, be given to women who have suffered a recent bereavement, or they are used to settle disputes. And they can also have important roles in ceremonies such as weddings and funerals. In fact, they are often so important for various other things like income generation and ceremonies and so on, that they're not consumed very much by the people who produce them. And this is a great pity, because if they could produce more, their children would be better nourished by having a high quality protein in their diet. And currently, stunting in Africa of children under 5 is around a third of the population, which is not good news at all. And pigs could do an awful lot to help.
So that's interesting that you're mentioning that. So like the people that are producing these pigs, then where would the meat go to? if they don't eating it, like if they don't eat it themselves?
It goes towards middle classes in small middle classes in some of those countries. It goes to, well, people who can afford to buy them, basically.
Right.
And often it's the case that livestock in general, except probably chickens, is too valuable to eat yourself. So you said it.
So obviously these are like much smaller number of pigs, sometimes maybe only one or two.
Yeah. The average herd size is probably, of what I'm talking about, is 10 or fewer pigs, occasionally as many as 20. In the free-ranging systems, it can be much larger.
So obviously this creates some issues for like disease risks. So can you talk a little bit about that?
Yes. I think smallholders, since the African swine fever globalization, smallholder farmers have been very much in the spotlight because it's in the small-scale farms that are actually most affected because they don't have the biosecurity to prevent it. Particularly in highly developed countries that either haven't got it at all, and I sincerely hope it stays like that, or their commercial farms have been relatively protected. And smallholder farms, more sort of home farming, has been affected. But because the African swine fever is often reported in those settings, people say, well, how dangerous are they for us and should they be there at all? And so we ask the question, do pigs in traditional free-range systems and backyards pose a disease threat to commercial pig production? They might pose much more of a disease threat to themselves because it shouldn't be the case that they pose a risk to commercial production, because while disease management in the low-input pig industry systems, particularly those where pigs are allowed to roam and scavenge or are fed leftover catering waste that hasn't been treated in any way, is extremely challenging. But the excellent biosecurity on commercial farms will ensure that there's no contact between their herds and the informal pig keeping sector. And for example, in South Africa, where we have got endemic African swine fever, endemic poverty, and the two going together very often, our commercial farms are very largely actually compartmentalized to keep them safe. And although we've been having since 2016, we've been having quite a lot of outbreaks in domestic pigs. There've only ever been 2 breaks in compartments, which is fairly, out of more than 300 compartments, which is fairly spectacular.
Yeah. So in that case, then, I mean, it does do something to exports, right? Like if a country first gets ASF. So because like I know, for example, here in Canada, there's a large focus on the small scale producers and trying to get them to understand the importance of biosecurity and premise IDs and things like that, just so that if ASF comes, that, you know, everyone is a lot better prepared. So I imagine it is somewhat similar in other countries.
Oh, definitely. I mean, it's not easy for us to export anywhere outside the region. Within the region, we do export quite a lot. Countries that have the same status basically as us, theoretically, at least under the World Trade Organization, shouldn't ban our pork but maybe they do. But the Indian Ocean islands really need pork, and they're quite happy to accept our assurances, our veterinary authorities' assurances that the pork has come from compartments and is safe. So we don't expect Europe to accept them, or Canada or North America. They don't actually need the little bit of pork that we produce anyway. But and of course, there are countries, neighbours as well, who produce pork themselves and feel that it would be a competition. So there's protectionism. But basically, our export potential would increase a great deal if we did have no African swine fever, obviously.
So would you suggest just having stricter regulations, or do we need to look at different approaches for these lower input settings?
I'm a very strong believer in different approaches, and I'm not a great believer in legislation because my country, for instance, believes that strict legislation will eventually provide the answer to problems. And these recommendations in the strict legislation range from providing good housing for pigs, prohibiting swill feeding, and even banning smallholder traditional and backyard pig farming. So far, that hasn't happened in Africa, I don't think, or in low-income countries, but it was done in Estonia, for instance, and they reduced the number of small backyard farms very much, although probably they weren't too bad. But and then, of course, if you break the law, they make provision for measures like heavy fines for infringements. But none of these have proven at all enforceable because they're completely impractical in settings where social economic imperatives determine the level of risk, and fines cannot be paid if there's no money to pay them. And you can't have a policeman in every household checking what they're feeding their pigs, and whether they're keeping them confined all the time. So the bans and the prohibitions don't help because the people just resent them and they simply don't report outbreaks, which is also a darn nuisance. So instead, engaging with the pig keepers and other stakeholders in the pig value chains, because they're very important too, of course, because they can deal in very risky practices. But engaging with them to find out what they would be willing to do, what would be practical, making them naturally aware of the risk, communicating the risk and saying, what could you possibly do about this? And we suggest the following possible measures. And one by one, they'll say, no, building houses from pigs. They want you to build better houses than we have ourselves. No, don't be ridiculous. Not feeding leftover food. No, we must feed leftover food. But one has to look at ways you can make it feasible. Because if you tell people not to do something impossible, like boiling swill for an hour before you feed it, they're just not going to do anything. They just won't do anything. Whereas if they boil it for 10 to 15 minutes, or even 5 minutes has been shown, it'll be fine. So they would do that because they can afford the fuel for that. And there have been some very good research that suggests simple ways in which you can prevent African swine fever. And there have also been some good initiatives in some countries like Kenya to integrate smallholder and backyard pig keepers into the formal value chains by providing training, initial feed and help with facilities, and getting them on board, because suddenly they really are making much more money, because obviously better pigs receive better prices, are accepted, don't have other conditions that would cause a condemnation. So it's an incentive thing rather than a big sledgehammer.
So I'm interested about the Kenya example. So do you have an idea of how they integrated them into the pork value chain, and where, who was paying for that, for example?
Well, the company, it was started by the very large commercial pig company, or very large. I mean, they've got big farms, and called Farmer's Choice. And they only the big abattoir and so on. And they looked what Kenya has that other countries often don't have, that a lot of their smallholder and backyard pig farming was pretty secure because it was done very often by pensioners, because people in most of Africa go on pension very early and they need something to supplement the miserable little pension that they do get. And pigs are often the answer. But they keep them nicely enclosed, and they might feed them leftover feed, but they'll be very happy to. I've seen them cooking it without being told to do so because they believe that will be a good idea. And there are a lot of awareness campaigns. And by helping those people to actually make commercial feed accessible to them, they have to buy a lot of feed for their big pig farms, so they can always do that by providing veterinary services, by employing their own vets, some of whom are specialized in going to the smallholder farms and educating them, training them, providing services, teaching them what to do themselves. They have managed to get a lot more pigs into their system because they can't really produce enough themselves. This does leave out the pigs from what we call informal settlements in Kenya, slums, where people raise the pigs, they wander around scavenging on garbage. They're often very much loved and looked after at home, but at the same time, they can't always afford to feed them. And I've seen some of these, and it's absolutely amazing. I mean, they're also very attached to their pigs, but they're not going to get those pigs onto a market. They're rather thin, and they're just not the right sort of pig. But these other smallholder pig farmers have taken a lot of the pressure off with any form of because they don't get African swine fever, just for a start. And I think it's been a great incentive for some people who were keeping pigs traditionally to say, "Hey, I'm going to ask about joining this scheme." Then their vets will go and train them and see what they actually need in startup support. And then after that, it's accepted that they're selling their pigs to the company, which pays a good price, and they will invest that money back into their pig farms.
So the government was never involved in any of this?
No.
No. Interesting.
No. They haven't interfered.
So could you see this being replicated in other countries, or is Kenya kind of unique in this?
I think at the moment Kenya is unique. There are other countries. They have expanded their operations into Uganda because there's a massive market for pigs in Uganda, because they have these things called pork joints in the cities, and they serve absolutely delicious grilled pork on skewers and beer, and they have TV where people can watch the football, and it's just a really lovely social thing. I was really surprised when I was taken to one, and we were even more surprised at what a nice meal we got and what a nice atmosphere there was. So, but they can't produce a lot of pigs, so they are farmers' choice has expanded somewhat into Uganda, also because Uganda is a very fertile country and feed can easily be produced there. But South Africa, our pork producer organization does what it can towards training and helping small scale and even informal settlement farmers, and they have saved some of them from African swine fever. But integrating them, not yet, because the situation with African swine fever doesn't really allow for that. We don't really have the same sort of conscientious small-scale pig keepers. They usually either have a formal sort of a farm, even if it's quite small, or they are people living in informal settlements in pretty basic conditions, and they don't own their own land, which also makes things really complicated.
So are there other practical steps that we can take to improve the pig health and welfare and productivity, like in those settings, like other than the Kenya example that you just shared?
The innovative research that's been done on African swine fever in recent decades has identified many ways in which simple risk-based biosecurity measures are affordable and culturally acceptable, that can reduce the risk of diseases, or all diseases, not just African swine fever, and improve the welfare and productivity of the pigs. And the big thing is that a lot of countries are now using community engagement, participatory, working with pig keepers in villages and so on, to get the whole village on board to see what can we do, and also finding out what are the cultural barriers to implementing biosecurity. For example, in East Africa, particularly, it's often considered very awful if you fence your property, because it's like saying to the neighbors, we don't like you, we're better than you, you're not as good as us, we don't want you walking through our property. Well, you don't if you're keeping livestock, but it's considered very abnormal to go and fence off the property and fence off your pigs and so on. And that is something that it was similar in Timor-Leste, funnily enough, and the Australians helping there managed to help them to see that these people were just trying to protect their livestock, but it still didn't prevent, either in Timor-Leste or in East Africa, from people being so jealous that those pigs aren't getting African swine fever because these wretched people are closing them up, that they actually infect the pigs when their pigs get infected.
No way.
Out of jealousy. So that is really, it is a big issue. We had a webinar once, and a woman pig farmer in Kenya told us what had happened to her, because her neighbors, some of her neighbors who kept pigs but kept losing them to African swine fever, got so mad when she had such success that she got a contract with a big supermarket to supply pork, that they infected her pigs. And it's not nice, but it's part of the poverty thing, I think. But a lot of people do, when they understand what it's all about and they get comfortable with it and they realize that, look, it's not him and me. I can do that too if I keep pigs. And if I don't keep pigs, well, it's not my business, is it? I mean, I walk through all my friends' properties who don't keep pigs. Fair enough. And on the other hand, also understanding that, well, when everybody's pigs are walking around and we don't fence properties, what do the people's pigs do? They come and eat my crops. Well, I could do without that.
Yes.
So, maybe it's not such a terrible idea.
So basically, it's really about communication, like trying to make people understand the importance of biosecurity and things like that.
Exactly. It's really a question of good communication and working with people, and especially the veterinary departments, not seeing the livestock producers as the enemy who gets them out of their air-conditioned offices to come and muck around looking at diseases in their animals, but as partners in trying to get less disease, healthier animals, so that they can stay in their air-conditioned offices and not have to go.
Interesting. So then, are there other examples of how transdisciplinary research has contributed to improving biosecurity and pig health in those systems?
Yes, there are examples, and we should be rolling it out far more than we are, because basically there was a Swedish-run led project in Uganda that set the models for this, and they've published everything that they've done. And what they have done, they've shown, is that involving social scientists, socioeconomists, and behavioral scientists has proven very useful in determining the root causes of unwillingness or inability to adopt essential biosecurity measures and identifying practical ways to address them. And in particularly, the behavior scientists have been very, very interesting, because they've also been used in other parts of East Africa, because they use approaches that make the people, everyone says behavior change. That's what we need, is behavior change. But you don't, once a person is over about the age of 12, you don't change their behavior very easily by arguing with them. And instead, you have to develop it and have a discussion that will eventually make them think, oh, but it's my decision. I decided to do it like that. And it can work very well. So they've had actually behavioral scientists doing their postgraduate and also social scientists doing their postgraduate studies in the same areas where they were researching African swine fever. and living with families and finding out what their ambitions were, why they kept the pigs, and why they couldn't do the biosecurity. And one of the initiatives between researchers and behaviorists resulted in the co-creation of contracts by researchers and signed by researchers and traditional pig keepers in a very poor district in Uganda, in which the pig keepers themselves determined which of a list of basic biosecurity measures would be feasible, affordable, and culturally acceptable to them, and which would effectively reduce or eliminate the risk of African swine fever, in spite of the fact that it is endemic in the area, including with the wild hosts, the reservoir hosts of the disease, of the virus. And it worked they went back after a year, after the contract was for a year, and they were allowed to choose as few as 3 biosecurity measures that they thought they could do. Some of them chose up to 9, but most of them chose about 3. And when they came back, they found that some, but not all of them, had been complied with for various reasons. And one that they wouldn't sign up to right from the beginning was the sharing of boars. They said that was quite impractical, because if they didn't share boars, they couldn't serve the pigs and they couldn't have piglets. So they were allowed to reject ones that people said, oh, look, it carries a risk, but let's just, for the time being, say okay. But as they saw that measures worked, it's very probable that they will adopt further measures. And they're following it up, of course, but the publications, most recent publications, I think were in 2021, were on the first year of the contracts. And then there's another initiative in East Africa, which is very interesting. It was conceived by veterinary researchers and economists in collaboration with the stakeholders in the pig value chain, including, of course, the farms, the producers, which aims to make insecure pig value chains that spread African swine fever much safer by establishing nodes where potentially infected pigs or pork could be bought for market prices, because people sell these sick pigs or potentially infected pigs. But if they can be bought for market prices, because usually they sell them, although they only get a low price for them because they're a bit suspect. Now they can get market prices, but they will be rendered safe by processing, which is perfectly possible. Or where necessary, they'll be safely destroyed and disposed of. And yes, the money's got to come from somewhere, and it's up to the economists to work that one out. And that would be supported by governments, but also by projects. And eventually they would hope to even have mobile abattoirs which would go and do the slaughtering safely at these places. We already have have pilot projects in South Africa for the foot and mouth disease value chains, so for cattle. So that could work very well. A lot of people's reaction is, oh no, but that'll probably spread it more. No, it won't spread it more, because it's happening anyway. It is spreading through value chains. And we're not quite as bad as, I think it was in Vietnam, they said there were people who were actually handing out business cards in the markets, dead pigs bought and sold. And it was pretty obvious that what the pigs would have died of probably would be African swine fever. But that's all under the radar in Africa, but because it's illegal, but it's there. It's called panic selling. And when soon as the first pig gets African swine fever, you quickly sell all the others, but several of them may be already infected. So this is an initiative to try and prevent that.
So that sounds really interesting. So do you know which journal this is published in?
The last one is not yet published. It was discussed at the gap analysis. The other one, it's published in, I think it's Frontiers, but I'm not sure. I'll check up and I'll let you know.
Okay, very interesting. So is there any other research or anything else you would like to share?
I think there's quite quite a lot of research also going on in various countries in our region anyway, to try and improve market opportunities for people who, particularly in the Eastern Cape, it's a great tradition to raise pigs there. It's our only province where because it's the people who live there who had a tradition of keeping pigs before. Now it's all over the country because it's helpful for income. But in the Eastern Cape, there are a lot of traditional pig keepers, and they have had both classical swine fever and African swine fever outbreaks. So they're very conscious of that. And a lot of them say they would like to do things better, but they're so far from the markets that pay, the city markets, that they can only get local prices. And we even saw that in a project that we did in Mozambique, a Danish funded project, where we had a study site in a remote area and one close to the capital city of Maputo. And we had huge progress. In 15 months, we had huge progress around Maputo because the people could get better prices. And in our rural one, no progress at all, because they said, well, we can invest, but we can't get returns on it because the local people simply won't pay more. And that project and others have been actually backed with porcine cysticicosis projects. It's quite useful because that is zoonotic, so you want to control it, but you don't really see it in much in the pigs. I mean, what are a few white cysts in the pigs? In the pork, it doesn't worry you. You don't know what it's from anyway. Whereas African swine fever kills your pigs. So if you focus people on both and say you do the same things to avoid it, then it worked quite well. It did work well in Tanzania, definitely.
It's time for our famous three.
Why Genetics turns podcast airtime into brand authority. We don't sell ads, we elevate voices. Curious how far your voice can go to become a reference in the industry and attract more leads? Scan the QR code and discover how we can turn your expertise into unmatched brand authority. Let's transform expertise into influence, starting now.
To our listeners, if you're enjoying this episode of the Swine at Canada podcast show presented by Wise Genetics, please remember to like, subscribe, and share it with your colleagues, friends, and family. So then we're getting to our final three questions. And I know that you've already answered them a couple times because you've been on the show, I think, at least twice. But the first one is, what is your favorite swine-related book or resource?
Well, that probably just changed because the 12th edition of the Diseases of Swine, which is an absolutely standard book, it's an American, but it's global and it's got authors from everywhere. I'm very proud to say that I'm the first author of the African swine fever chapter. Not the lead author who's at the end, but she invited me, and it's a great honor. And it has just been published in ebooks and hard copies, and of course it's really expensive. But it's definitely, I've got the ebook, and it's definitely going to become a very favorite resource of mine because it really covers everything and has a chapter on a section on the healthy pig. It's just a great go-to for anything you need to know about.
Okay, excellent. So then what about a favorite book or resource outside of agriculture?
I think I say something different every time, but I actually, as far as books go, I love travel books and I love murder mysteries. And my favorite resource, otherwise, is definitely my greatest resource, is my husband, who's been supporting me amazingly for 61 years, and he is definitely my best resource ever.
I remember you said that last time as well, and I think it's such a great one because, like to have that support makes you able to do what you do best. So that's amazing. Yes. Okay, and then the last question, in your opinion, what sets successful swine professionals apart from those that are not?
Well, that I think I always say the same thing, and that is that I think a great communicator, a great cooperator, someone who can really collaborate with the industry or the sector, whoever they are, is the most valuable asset for that.
Okay. Well, thanks so much for joining me on the Swine in Canada podcast show today.
Thank you very much for having me. I really have enjoyed each time that I've been on the Canada Swine podcast, and I always enjoy the messages that I get from some of my friends in other countries and people I haven't heard from for ages once it goes live. So thank you very much for the opportunity.
All right, so that concludes another episode of the Swine in Canada podcast show. So thanks everyone for joining us today. Don't forget to subscribe to our podcast to stay updated on future episodes. And if you enjoyed today's episode, please give us your feedback because that is very valuable to us. So this is Miranda Smith signing off. Until next time.